Several episodes ago, we showed you the cooling cap, a once experimental device that can put the freeze on problems that can happen when there are complications during birth. As Doug Johnson shows you, the cap, now in general use at Baptist Women's Hospital, is showing dramatic results in protecting your child's health.
This is what we call our wall of hope, and these are pictures of former NICU graduates.
For Dr. Jane Hayden and others, it's all about hope in the NICU. The neonatal intensive care unit at Baptist Women's Hospital uses advanced technology to help babies in trouble. That tech includes a cooling cap. It cools an infant's brain to 94 degrees and slows damage that can be caused by blood loss during birth. Because of that, it can lead to improved outcomes.
Tell me about this little guy. Who is he?
Well, this bright little happy baby, it's so neat to see that picture of him because he was our first cool cap patient.
The cool cap has been in use at Baptist since late 2009 and is used on average about 4 times a year. The cooling effect deals with the problem of oxygen-carrying blood being cut off at birth. That blood loss can kill brain cells and cause serious developmental problems.
This is a therapy that really needs to be used within 6 hours of the birth for it to be the most effective.
Then she cast a spell on the prince, turning...
That's what happened in January 2011 when Tiffany Gonzalez was delivering Amber. Her daughter's birth was different than her son Enrique's. She found out quickly that something was wrong with Amber.
Minutes, because I knew, when a baby is normally born, they bring them over to you and, clean them off and everything else. Well, they weren't doing that. They were over there, they had the team, they were really quiet. And I really wasn't understanding what was going on. Then they were saying, oh, she's intubated. And I'm like, wait a minute. No, that doesn't sound right. I just had a normal baby. What are you talking about?
The cooling cap is placed on a child's head for exactly 72 hours. Each child's results are different, but here are some encouraging numbers. The cooling effect can save from 80 to 90% of brain cells that could otherwise be lost. Sometimes the results are surprisingly good.
Oh, wow. The Gonzalez baby was extremely critically ill. We were very surprised that the baby even made it through the cool cap experience.
The long-term effects of the cooling caps is one of those things where time will tell. Doctors will track babies' neurological progress to see how well they're doing over time.
They're very surprised. So far, she's meeting all of her milestones. That's what they're concerned with. They're just basically looking as to her meeting her milestones right now.
The NICU team expects to use the cool cap and induced hypothermia more often in the future, and their hope is that they'll see more good results. For Smart Medicine, I'm Doug Johnson.